What if I told you there are simple, practical ways to make your penis appear longer without spending a single dollar? Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon. And if you've ever wondered about your body in this way, or felt uncertain about what's normal or what's safe, stay with us. Here to help you understand your health with clarity, compassion, and confidence. If you're new here, we create urologic content every Monday and Friday to help you navigate your body with knowledge and care. Make sure you subscribe and share this channel with anyone who might benefit from honest, patient-centered guidance. Now, you're here because you're curious, and you're not alone. Millions of men around the world wonder if there's something they can do to feel more confident about their appearance. And while I have your attention, let me say this clearly. No pill, no cream, no herbal supplement, and no miracle powder is going to make your penis bigger. Save your money, save your hope, save yourself from disappointment. But what I can tell you is this. There are real, evidence-based, completely free strategies that can help your penis appear longer. These aren't gimmicks. They're rooted in anatomy, physiology, and common sense. Let's walk through them together, calmly, clearly, and with respect for what your body is capable of. Number 1, trim or shave your pubic hair. This is the easiest, most immediate thing you can do. I've been a urologist long enough to see every variation of grooming, or lack thereof, and I can tell you honestly, if you have thick, coarse pubic hair, it can actually hide a significant portion of your penile length. Think about it. If there's an inch or more of hair covering the base of your penis, that's an inch of visual length you're losing. Simply trimming or shaving that area can reveal what's already there. This isn't about vanity. It's about letting your body be seen for what it actually is. If you're wondering about the safest way to groom that area, what tools to use, how to avoid irritation or injury, I have a dedicated video on that. I'll make sure it's linked for you, but the short answer is, be gentle, use clean tools, and take your time. Number 2, lose weight. This one is harder. I'm not going to sugarcoat that, but it's also one of the most effective ways to reclaim visible penile length. Here's what I want you to do the next time you're alone and looking in the mirror. Push down on the fat pad just above your penis, what some people call the fupa, or fat upper pubic area. Push it down and look at your penis. You'll likely see more of it. That's because the erectile tissue of your penis doesn't stop where you can see it. It extends deep into your pelvis, anchored behind the pubic bone and into the perineal region. There's more there than meets the eye, but when you gain weight, especially around the abdomen and pelvis, fat begins to accumulate in that area. It doesn't make your penis smaller, it just buries it beneath layers of tissue. I've had patients come in genuinely worried that their penis has shrunk. And when we talk through their history, they've often gained 20, 30, even 40 pounds over the past few years. The penis hasn't changed, the fat around it has. So losing weight through a combination of healthy eating, regular exercise, and sustainable lifestyle changes can genuinely restore visible length. It's not a quick fix, but it's real and it works. Number 3, manage your anxiety. You might be wondering how anxiety could possibly affect the appearance of your penis. Let me explain. The smooth muscles inside your penis are under what we call adrenergic control. That means they respond to adrenaline, the hormone your body releases when you're stressed, anxious, or in fight or flight mode. When adrenaline levels are high, those smooth muscles contract. And when they contract, the penis pulls inward. It becomes smaller, tighter, more withdrawn. I've seen patients with chronic anxiety who report that their penis sometimes seems to shrink back into their body. It's not in their head, it's a real physiological response to stress. Over time, as they work on managing their anxiety through therapy, mindfulness, lifestyle changes, or medical support, they notice their penis returns to its normal resting state. The tissue relaxes. The length becomes visible again. So if you're someone who carries a lot of stress, or if you've been dealing with performance anxiety, social anxiety, or generalized worry, working on that can have a direct, positive impact on how your penis appears and functions. It's not just about mental health, it's about physical health too. Number 4, continue having erections. Erections aren't just for intimacy, they're for health. When you have an erection, blood flows into the erectile tissue of your penis. That blood carries oxygen, and that oxygen keeps the tissue healthy, elastic, and functional. That's why you have erections at night, 3 to 5 of them, in fact, during REM sleep. Your body is protecting your penis. It's maintaining tissue health even while you're unconscious. I've talked about this phenomenon called nocturnal penile tumescence, or morning wood, in other videos. If you're curious, I'll link those for you. But here's the key point. When you stop having erections, your penile tissue suffers. Chronically low oxygen levels can lead to tissue stiffness. Over time, the erectile tissue can lose its elasticity. Fibrosis, scar tissue, can form, and that scar tissue can shorten the penis. We see this most clearly in men who undergo radical prostatectomy for prostate cancer. If the surgery damages the nerves that control erections, and those men become impotent, they can lose anywhere from half a centimeter to 5 full centimeters of penile length within 14 months. Now, most men don't face that level of nerve damage, but the principle holds: use it or risk losing it. If you're struggling with erections, whether due to stress, health conditions, medications, or other factors, please see a urologist. We have treatments, we have solutions, and we can help you protect your tissue health before long-term changes occur. I also have a dedicated video on how to achieve stronger, healthier erections. It covers causes, treatments, lifestyle changes, and medical options. I'll make sure that's linked as well. So there you have it. 4 completely free, evidence-based ways to help your penis appear longer. 1. Trim or shave your pubic hair to reveal what's already there. 2. Lose weight to reduce the fat pad that hides penile length. 3. Manage your anxiety to allow the smooth muscles to relax. 4. Continue having erections to maintain tissue health and elasticity. None of these require surgery. None require spending money on unproven products. They simply require attention, intention, and care for your body. And if you take nothing else from this video, I want you to remember this. Your worth is not measured by the size of your penis, but your health, your confidence, your peace of mind, your ability to care for yourself. Those matter deeply, and those are things we can support together. If you're struggling with erectile function, body image concerns, or questions about what's normal, reach out. Make an appointment with a urologist. Talk to someone who understands both the science and the humanity behind these concerns. You deserve answers, you deserve clarity, and you deserve care. Thank you so much for watching, and as always, take care of yourself because you're worth it.